Now, going to talk to Jennie Dale from Dense Breast Canada. We've spoken to Jennie before on VOCM. Dense Breast Canada been keeping an eye on different Canadian jurisdictions as it relates to aspects of breast cancer treatment and screening. Jennie and her group had a Facebook message out today that was very critical and forceful of what's not happening in Newfoundland and Labrador. Jennie, how are you today?
I'm fine, thanks. Thank you for having me on.
Good to have you on. So what has got your dander up about the government of Newfoundland and Labrador right now?
Oh, that's exactly it. Our dander is up. We have attended many meetings over the past 8 years, but this particular meeting on Monday with the leadership of Newfoundland Health Services, Eastern Health, Cancer Care, got us really concerned for the women of Newfoundland, and we just felt that their health was not being prioritized because we had a meeting in March where we felt things were moving forward, that there was going to be action on self-referral for mammograms in the 40s, that women were going to be informed of their breast density. We had a positive meeting in March, and then we had this meeting on Monday. It was like, wait a minute, we are going backwards here. And so there are no dates, no commitments. We were just stunned, and we feel the women of Newfoundland need to know that they do not have the same chance to find breast cancer early as the women in the rest of the country, and their health is just not being prioritized. So that's what
Jennie,
got us angry.
Well, and based on what you said, I can understand why. I remember covering this in the spring, and there were a lot of big words used to describe how important it was. Lots of research suggesting other provinces doing it, screening for women 40 and forward. So why has there been no action to meet those words from your based on your estimation of it?
Well, in May, the Premier came out and said that the province was going to drop the screening age to 40, effective immediately. And then the former health minister came out and said, no, we need to, put, certain things into operation here. We'll get back to you with a date. That date does not exist. So, it's very normal for a province to have to find extra technologists to perform the mammograms, and that's not an easy thing to do given the shortages in Canada. So things that have to be put in place. Ontario is happening October 8th, and they did take a year to implement. But the response we got on Monday was when we asked, well, when do you plan to implement screening self-referral at 40? We were told, well, Ontario took a year, maybe we'll take a year. So it was just very, well, what have you got to do with Ontario? Your capacity situation is different than Ontario. Do you have a plan? Are you working on this? Because 17% of breast cancers happen in the 40s, and this is a potentially life-saving policy change that we need to see implemented now. And there's just seems to be no urgency on it, whereas the rest of the country has moved forward.
You've not had the opportunity, I'm guessing, then just as I hear you, to talk to the new health minister to get his perspective on this. I'm assuming, and you can clarify accordingly, that these, not to diminish what they were saying or to take away from your arguments, but these were senior bureaucratic health officials you met with?
Yes. We were at the top. Certainly the minute we got off that call, we started writing letters to the health minister because we were just shocked that this is not a priority, especially since the rest of the country is moving forward and you're putting women in Newfoundland at a disadvantage. There's no cure for breast cancer. The only way to survive breast cancer is to find it, the best way to survive breast cancer is to find it early. And if we don't allow women to self-refer, that means they have to get a requisition. Most women don't know in their 40s that they should go to their doctor and get a requisition, and sometimes when they go to their doctor for a requisition, they are denied or dismissed because the province screening age is 50. So in the meantime, cancers are being found later because cancers in the 40s are very aggressive and they just keep growing. So we need to give women the chance to find them at stage 1 versus stage 4. And this is something I just want to say that can save the province a lot of money and reduce the burden on the healthcare system. Because when we find cancer at stage 1, the cost is average about $40,000 versus stage 4 could be $500,000 to treat breast cancer. So you're also reducing the burden on, you need less oncologists, radiologists, less chemo, OR time, surgery time. Women can get back to work faster. It's just really, really important to get these mammograms done in the 40s.
Two last quick questions for you. I know with other health procedures and tests, Newfoundland and other jurisdictions sometimes have the facility to say you could go to Ontario. Not that in any way, shape, or form is an acceptable answer. Did you get any indication if that was an option that Newfoundland was put on the table?
No, that did not come up, and there's no private options in Newfoundland. Yeah. But I have heard from women, certain times that they are traveling to Ontario to get the test, especially if they have dense breasts and they aren't able to get the additional screening that they need. And, that's another area we don't have time to get into right now, but women in Newfoundland it's the only province where women cannot find out their breast density. Only women in the highest category are being told. So, and that was supposed to be implemented in the spring, and now we have no date.
Okay, I got 30 seconds for this one, but I think you're making the case for what I'm going to ask you, which is for people that are listening today who aren't happy about what you're telling them, what can they do?
Please contact your political representative and your health minister and your premier and tell them that your health matters, that you deserve the same chance to find breast cancer early as women living elsewhere. It's just not right.
All right. Well, Jennie, thank you for being with us today and raising this story. I'm sure it will get a lot of attention, which it should. Thank you, Jennie Dale. Appreciate your time.
Thank you so much. Thank you. Bye-bye.
Okay. That was Jennie Dale from Dense Breast Canada. We will look to see if we can get Health Minister John Hogan on tomorrow to speak to this, to speak to what may have happened at that meeting from his official's perspective. We do remember certainly the Premier's statement last May about wanting to get these barriers down and these tests up and running. We'll see if we can get an official answer on all of this tomorrow on our program.